So let's talk about the symptoms of GERD. What is GERD? It stands for Gastroesophageal Reflux Disorder. And basically, in a thumbnail sketch, it's a chronic problem with the valve on top of your stomach. It won't close that well, and all the acid kind of comes up. Now, the problem with that is that there are certain enzymes in the stomach, certain enzymes that are protein enzymes that are really, really powerful, that can break down a steak in your stomach. If that thing gets up there, it can actually start dissolving the esophagus all the way up and irritate up into your throat. And that's why these are the symptoms: acid reflux, belching, excessive saliva, a feeling that food gets stuck in your throat, sore throat, hoarseness, even a sour taste. Okay, so those are some of the symptoms. But, if you look up GERD, it'll say, well, we don't really know what causes it. It's an unknown cause. No one really knows. But let's just look at the physiology. I think it's important to understand that there is a cause for every symptom. And that is this. This valve is linked to the pH of your stomach. The physiology of what closes that valve is what the pH is down here. Normally, the pH should be between 1 and 3. Now let's take a look at this. A neutral pH is 7. Anything lower is acid. Anything higher is alkaline. So if it's 7 and it goes from 7 to 6, that means that 6, if you have a pH of 6, that's 10 times more acid than 7. Okay, so it compounds by a factor, a power of 10, every whole number lower. So 1 to 3 is extremely acidic. Okay, as you age, you lose this pH. Especially if you have any heartburn and things, chances are your pH is probably 4, 5, 6. All right. There are certain tests that could be done, but a lot of times you have to request them, and it's hard to find someone to do a test to measure the pH. But what I would do, if I were you, is I would take an acidifier and see if you get better. Like it's an inexpensive way to see if that was the problem. Okay, so if you need a good one, a natural acidifier, have one below, the link below. But what you want to do is you want to make the stomach more acidic so this valve will close. And what you do is you take these acidifiers before the meal. Sometimes you'll start with like 3, 4, maybe even 5 at first, and then you can take less over time. But if this stomach is not between 1 and 3, this valve won't close. You'll get undigested food, get some gas, all sorts of problems, because we need this pH to digest protein and absorb minerals. Those are the two big factors. Okay? Hope this helped. I'll see you in the next video. Hey guys, thank you so much for watching. I really appreciate it. Please click the share button below, and I will see you in the next video.